Hi, I'm Hilton Gottschalk. I'm a pediatric orthopedic surgeon and a pediatric hand surgeon here at Central Texas Pediatric Orthopedics in Austin, Texas. Today we're going to talk about pediatric trigger thumbs. We're going to talk about what is a pediatric trigger thumb, how do we diagnose it, and then what are the different treatment options that you have for your child. A pediatric trigger thumb is similar to that in an adult, although it's 10 times more likely. What happens in a pediatric trigger thumb is that the tendon that goes to bend the thumb down tends to get caught on a little structure or pulley in the palm of the hand. And what happens is you get inflammation of that tendon, and then that tendon bump gets caught underneath that little pulley. It often gets confused with a fracture or a dislocation, and sometimes patients will come in with x-rays, although it doesn't show much besides the finger or the thumb in a bent position. To diagnose a trigger thumb in a kid, it typically really is more clinically based. And so we will find that there's the bump at the base of the thumb. The joint of the thumb, called the interphalangeal joint, will be held in a bent position. And a lot of times parents will not really notice that it's been going on until they ask their kid to make a thumbs up, or they go and examine their child and they notice a small little bump at the base of the thumb. But there are no radiographs or ultrasounds or MRIs or special tests that are required. Most pediatric trigger thumbs that present with the thumb being able to be locked or unlocked easily, we will typically provide a nighttime brace that the child will wear for about anywhere between 2 to 6 months solely at night. The thought behind this is we're trying to bring down the inflammation within that tendon or around that tendon, and that by splinting that thumb in a nice straight position, it helps to bring that inflammation down. In adults, one might hear that they do steroid injections. In kids, we do not do steroid injections, really more of a nighttime bracing for those kids who can tolerate it well. Let's talk about different treatment options for trigger thumbs. We'll start first with the non-operative treatment. Pediatric trigger thumbs that either do not respond well to a nighttime brace, or thumbs that are already sort of held in a very locked or flexed position where you cannot unlock it easily or cause lots of pain, and also any thumbs where there's hyperextension to the thumb joint base over here, those kids may then need a surgery. Typically it's a day surgery procedure. It is a general anesthetic, and we try to operate on these kids between the ages of 2 to 4 years. And the reason for that is, under age 2 years, two things. One, the anesthesia is much safer after age 1 or 2. Number two, the likelihood of having it on both thumbs is about 33% of the time, and I have found that after age 2, if they don't have it on the other thumb, they're likely to not have it on the other thumb. Typically, it's about a 20-minute procedure. Your child will have a small incision that starts at the base of the thumb here within this little crease. And then what I do is open up that little pulley, and that's it. We do not work on the tendon. And then we'll have some small sutures on the outside that will eventually dissolve or unravel. And your child will either go into a big thumb brace or what we call a soft cast, depending on their age and how rambunctious they really are. Typically, we will keep them in that brace or cast for about 1 week, and then you'll come back, we'll take the brace or cast off, and then typically apply just a small little Band-Aid to that area, and then at that point, have your child start getting the incision wet so that the sutures can then unravel. No physical or occupational therapy is usually required in these young kids, and really just get them to use it. The likelihood of recurrence in a trigger thumb is very low. In fact, it's usually less than 1%. Most of these kids do very, very well, and typically from a pain control side of things, typically just have them take an anti-inflammatory such as Motrin or ibuprofen, or even Tylenol afterwards, just for the first day, and most of these kids do great. It's easy to go online and read different things about trigger thumbs, and perhaps should you massage this, should you tape this? Again, as we talked about, when's the right time for surgery? My experience has been, if we can get to these kids at a younger age and try to provide that brace at night for these kids, most of them will do really well. And our literature tells us that they should wear that brace for about 6 months. I typically like to try it out for 2 months first and see how well your child is tolerating it. before we really traumatize you and your child by trying to keep this brace on. If it does come down to a surgery, my experience has been these kids do great. And again, the recurrence rate on these are very low, less than 1%. And most of these kids do excellent, and rarely do they require any kind of therapy afterwards. With pediatric trigger thumbs, timing is important. And so if you do suspect that your child has a trigger thumb, please call us and reach out to us. We're here to help.